Okay, good morning and good afternoon. I'm going to talk about air quality management in the UK. And because this series is about air quality management, so previous presenters from the UK have given you some idea about how the air quality in the UK is and how it is addressed at different levels. In spite of many developments in the last 25, 30 years, there are still challenges in meeting air quality standards and objectives within the UK. So local authority level and central government level, new developments are taking place. Local authorities and those who are responsible for delivering air quality in the country are facing a lot of challenges. As we discussed before, some political challenges, some economic challenges, some personality challenges, and technological challenges. So we are going to look at some of those challenges we are facing here in the UK and what are the new developments to overcome those challenges. First, I will give you a very brief perspective, global perspective of air pollution, its relationship with health, how it affects. Then I will give you some indication of how air quality in the UK has changed, what are the main sources. Then we look at how air quality is managed in the UK and how hotspots are the areas which exceed the standards are declared. And once they're declared, what do we do to bring the levels or exposures down to acceptable levels? So what are the challenges there? Then in the end, I will present the new developments which were listed by Gopika in the introduction, and we'll see how they can help us in achieving the goal of delivering good air quality for the citizens in the UK, and probably other countries can also learn from our experience here. We all know, I don't have to reinforce this because previous 37 presenters have highlighted how important the issue of air pollution is. Understanding where it is generated and how it can be managed. So air pollution is one of the biggest global public health hazard. A recent study which published the ranking of risk factors for health for the world has listed air pollution as the fifth biggest factor causing deaths in the world. Everyone knows WHO figure of 7 million deaths per year. So that is health effect. It also has economic impacts. People do not realize that exposure to air pollution can cause economic impacts as well. So it's close to $3 trillion per year because of absences from work, people going to hospitals, needing treatment, and government and individuals spending money on their treatment. That costs about $3 trillion per year. We all heard in the last 3 to 4 years the impact of COVID. And we also looked at how and who are the people who were affected by COVID. Several studies were conducted and they all came to conclusion that people who were exposed long-term to air pollution, they were most likely to be affected more severely by COVID than the people who were not exposed to higher level of pollution. So there is a clear link between long-term exposure to air pollution, your immunity and resistance to impact of exposure to air pollution. So out of these 7 million deaths, predominantly they're being caused in developing countries. And if you look at the bottom box here, it says that Bangladesh, China, India, and Pakistan have 49 of the 50 most polluted cities in the world. And if you look at this map, it shows one of the key pollutants, PM 2.5, and you can see the belt in the middle in Asia, Southeast Asia, Africa, and Latin America. You can see this is where the PM 2.5 levels are higher than the upper part of the globe. And that directly links with number of deaths attributed to air pollution. So 7 million deaths, and you can see the darker colors represent the number of people whose death can be attributed to air pollution. And again, you can see the band near India, Pakistan, Bangladesh, and Southeast Asia. So what are the symptoms? What are the diseases which are linked with air pollution? And air pollution is a significant contributor to many of the diseases. For example, if you pick up lung cancer, about 20% deaths are attributed to air pollution. COPD, which is respiratory illness is 41%. And look at other figures, stroke, diabetes, heart disease, respiratory infections, they range from 11% to 35%. So air pollution is a big public health hazard. It doesn't receive as much attention as it should receive. If you look at the number of people who are suffering and dying from exposure to air pollution, there should be an a global emergency declared because of air pollution. But we don't hear much about exposure unless you are in the sphere of air pollution research or teaching. You will not hear much about air pollution. Only when we have certain episodes, for example, currently going on in Delhi, you will hear about air pollution and then people forget about it once the episode is gone. So PM 2.5 pollution is PM 2.5 is one of the biggest contributor to air pollution related health effects. So it was linked to nearly 3 million early deaths in 2017, and more than half of these deaths occurred in China and India and South Asian countries. So other than the diseases I have listed before, air pollution is also linked with neurological disease. It is also linked with decline in cognitive functions, how brain responses to stimulations or stimulants. So people's thinking process can be affected, and that's why it's called cognitive decline. Responses to different stressors can be worsened if people are exposed to air pollution. There have been studies which have linked exposure to air pollution with reduction in fertility and child obesity and childbirth incidences. Childhood obesity is one of the biggest factor, but not many people know that it is also linked with exposure to air pollution. So here in the UK, the abstract for my seminar says is about 26,000 to 33,000 number of deaths attributed to air pollution. So UK government set up a committee called COMEP, Committee on Medical Effect of Air Pollutants. And they carried out rigorous investigation, gathering of evidence, and they came up with a figure of 29,000 deaths in the UK per year linked with PM 2.5 alone, 29,000 deaths per year. Then European Commission, Global Burden of Disease Study, and Department of Environment for Food and Rural Affairs in the UK, they all have come up with range of estimates depending on which methodology they have used, but you can see the number has varied from 29,000 to 52,000 if you combine other pollutants. Multiple pollutant effect is more than just single pollutant. For example, 2.5 is only 29,000, but if you combine the effect of NO2 and P2.5 is about 52,000 deaths per year. So very recently, the UK's England's chief medical officer published a report. They publish a report annually, but annual report of 2022 focused specifically on air pollution, realizing the importance of air pollution's link with health. So on the left-hand side, you can see the life course effect of air pollution on humans, right from the pregnancy all the way to childhood, adulthood, and when you are old. So low birth weight has been linked with exposure to air pollution. Children are one of the most vulnerable groups, children and elderly and people who are already suffering from certain health conditions. they are the most vulnerable when it comes to exposure to air pollution. In children, asthma, we are very well known that it is linked with exposure to air pollution. Not many people know that it is also linked with developmental problems, slower development of lung function, and start of atherosclerosis. I don't know how many people know this. This is the beginning of narrowing of arteries in the body. Narrowing of the arteries is linked with heart disease and stroke. So that shows that even at childhood stage, exposure to air pollution can lead to bigger problems when people become adults. So heart disease, lung cancer, COPD, diabetes, they're all linked with exposure to air pollution. In elderly, it can accelerate decline of lung function. So again, respiratory illnesses and stroke, dementia. Dementia is also linked with exposure to air pollution. And on the right hand side, you can see the name or the type of the pollutants which affect different organs or systems of the body, right from the brain to our eyes, nose, and throat to lungs and kidneys and reproductive system. So I'm not going to go over every organ and which pollutants are linked with it, but you can see that 3 or 4 pollutants predominantly affect most of the system, human system and organs. So how is air pollution changing in the UK? So the peaks of air pollution were around 1970s and 1980s, and then the government started taking action, developing policies and regulations to bring the air pollution emissions and concentrations down. So this slide shows how, with respect to 1970 levels of different pollutants, PM 2.5, 10, nitrogen oxides, ammonia. Not many people link ammonia with as an air pollution, but ammonia is also one of the biggest contributor to air pollution exposure. So you can see there has been a steady decline in emissions. This slide shows emissions, not concentrations, of the major pollutants here. So if you just pick up one example, for example, here PM 2.5, and look at the sources. So if you take NO2, for example, you will find that you can identify the sources more related to the use of fossil fuel, motor vehicles, industries. But particulate matter, which is linked with, say, 29,000 deaths in the UK and 3 million deaths globally, you can see it is not only the road transport and industrial sources, but also resuspension of dust, brake and tire wear, cooking, domestic fires. Don't know whether can you see my mouse? Probably just
Yes, we can see.
pointer. Okay. So if you look at, for example, a typical urban center, you can categorize the sources into 4 sources. Natural sources, for example, sea salt, wind-blown dust, forest fires, and so on. Natural forest fires, they contribute a small portion. Then transboundary, which is coming from international other countries. For example, here in the UK, coming from southern part of Europe, Spain, France, and all the way up to Sahara Desert. Then you have regional PM 2.5, which is contributed by neighboring cities and towns. That is again significant. Then in the city itself, you have urban contribution caused by motor vehicles, industries, brake and tire wear, cooking, and other combustion. So this is what we are trying to reduce in the Department of Environment, Food and Rural Affairs. They predict that by 2030, we should be able to bring down the PM 2.5 concentrations below the WHO standard of 10, which is WHO 2005 guidelines. But now the new WHO guideline, which came out in 2021, has recommended 5 microgram per meter cube of PM2.5, which is going to be very difficult to achieve here in the UK, where generally because of the weather and meteorological conditions and sources is still lower than many other countries, and we will be struggling to achieve WHO standard 2021. So the UK government has developed this framework called Air Quality Management Framework. So they ask every local authority to carry out monitoring, conduct modeling, and apply source apportionment studies to find out what are the areas where air quality standards exceed or exceeded. If they are exceeded, then they had to declare those areas as air quality management areas, AQMAs. Then the local authorities will have to develop air quality management strategies. Some are short term, some are medium term, and some are long term. Some are tactical, which is only applied to a particular area, and some are strategic, applied to the whole city and the whole region. Some measures are hard, like technological measures. Some measures are soft, for example, encouraging people to shift the mode from private transport to public transport, from private transport to active travel like walking and cycling and so on. So soft measures are very important. Then the local authorities evaluate the impact of these action plans before implementation, during implementation, and after implementation. Find out whether a particular strategy has been effective or not. So this air quality management framework is slightly different for three, four regions of the UK. In England, it's slightly different than Scotland, Wales, and Northern Ireland, but every part of the country has to conduct this air quality management appraisal process, produce report, and every local authority in the UK is required now to submit annual progress report or a status report. The names are different for different regions. And if the problems are still there, then you have to declare action plan. What are the plans? What are the ways in which local authorities can use to manage air quality in their jurisdiction? Action plans. So a lot of local authorities, more than 500 local authorities, and they all have come up with different action plans. So you will see in the next slides that there are plenty of action plans, but still there are exceedances of air quality standards in the UK. So these are air quality management areas declared in the UK, right from Northern Ireland, Scotland, England, Wales. And you can see most of them are focused around big cities, London, Birmingham, Manchester, Liverpool, Newcastle, Edinburgh, and this here in Dublin. So the latest figure which we have are about 638 air quality management areas declared in the UK. Predominantly, you will see that they are declared for NO2, nitrogen dioxide level. So NO2 standard in the UK is 40 microgram per meter cube annual mean, and more than 600 air quality management areas are failing to meet standard for NO2. Some air quality management areas are declared for PM10, PM2.5, and sulfur dioxide. Not many. These are mainly related to power stations and steel plants. If you look at the sources, again, transport dominates the air quality management area declaration. Different types of roads, highways, and so on. And then you have industrial sources, domestic heating, industrial processes, which are responsible for AQMA's declaration in the UK. So different authorities have adopted different approaches to declaring air quality management areas. So you carried out monitoring, you had carried out modeling, and certain areas in your local authority jurisdiction are not meeting the standard. So you can declare air quality management area along the source where or along the area which is not meeting the standard. For example, here in Manchester, all the roads have been declared as air quality management areas, the major roads. Whereas next to Manchester, you have Liverpool here. They have declared all of Liverpool as one air quality management area. Their philosophy is that instead of controlling individual roads, we will rather control all the sources within Liverpool local authority and then try to achieve the standard. In London, again, all of London has been declared as a quality management area. Whereas here in Newcastle, it's a mixed approach. We have some roads which are declared as AQMA, and Newcastle city center here, all of it is declared as a quality management area. South of Newcastle, another town, Gateshead, they have also declared an area, AQMA. So you have different approaches, but they're all trying to address the same issue, that these areas are failing to meet air quality standards for predominantly NO2 in this case. So they have come up with solutions working with the central government, DEFRA, coming up with the plan. So DEFRA have recommended that most of the local authorities should consider air quality zones. So you can call them low emission zones, clean air zones, or ultra low emission zones. So in London, it is called ULEZ, ultra low emission zone. Any vehicle which is entering now predominantly most of London, they must comply with certain emission standards. If those vehicles do not comply with that emission standard, they cannot enter, or if they enter, then they have to pay a very hefty fine for entering that particular zone, low emission zone or ultra low emission zone. So there are about 26 such zones declared in the UK. 8 local authorities are considering implementing them. 42 local authorities or areas they thought of implementing clean air zone or low emission zone, but now they have become compliant, so they are no longer going ahead with the plan to have clean air zone or low emission zone. So CAZ is clean air zone. So there are 4 types of clean air zones in the UK, and they're called ABCD for the sake of simplicity. So some cities have gone for class A, so which is basically only buses, taxis, and private hire vehicles. They are covered under that clean air zone legislation. So if they don't meet the standard, then they cannot enter that particular area. Then you have class C and all the way to class D, which includes private vehicles. This is where sometimes political debates happen, and some local authorities had to change their plan from class D to class C, because class D included private cars, and when there are a large number of people involved, then there is more political unrest. So some of the local authorities have gone down from class D to class C, so basically only covering buses, coaches, taxis, and minibuses and vans, but not cars. And these are the standards, Euro standards, which is similar to Bharat standard in India, the Euro 5, Euro 6. And if it is a diesel car, then Euro 6. If it is a petrol car, then Euro 4 is required. So far, 7 cities have gone ahead with clean air zones: Bath, Birmingham, Bradford, Bristol, Newcastle, where I am currently, and they have mostly gone for class B and C. But Birmingham and Bristol are the local authorities which have gone ahead with class D, where even cars are included. So if a vehicle is not complying with this standard here, and if it is a private car, then you're paying £9, which is about 900 rupees per day to enter this zone. And if it is a heavy goods vehicles, is about £100, and buses and coaches again £100 per day to enter clean air zone. Besides these clean air zones and low emission zones, government is also focusing on technology, so electrification of vehicles, promotion of electric vehicles. Integrating public transport systems, because many times in many cities public transport systems are not integrated. If you're coming by bus and if you want to catch the metro, then may not be a good connection between the bus services and the metro systems, or if you come on your bike, there may not be enough spaces for parking your bike and so on. So now the government, local authorities are going ahead with integrated public transport systems. So Manchester and London are the two very good examples of integrated public transport systems. In Newcastle, where I am currently, there is no integrated public transport system. So many bus operators, each operating on maybe similar route, same route, and competing with the passengers for ridership. So the empty buses are running on roads. That is not a good way of running a public transport system. And then you have park and ride schemes where you bring your car to the outskirts of the city and take the bus to the city center. So that reduces number of private vehicles going to the city center. There are also in London, most of London now and many other cities, there is a speed reduction in cities. So it has gone down from 30 miles, which is 50 kilometers per hour, to 20 mile, 20 miles per hour, which is about 30 kilometers per hour. Then you have new technology, adaptive speed management. Vehicles are now fitted with the technology which will automatically reduce the speed of vehicles if you're to a zone where the speed limit has changed. On motorways, they have variable speed. During peak times, the speed is reduced from 70 miles per hour to sometimes 60 or even 50 miles per hour, so that traffic flow is smooth. Freight also, goods delivery also contributes significantly to air pollution in cities and towns. So how do you manage your freight is very important. People are buying more and more online, so the deliveries, vans which are delivering goods to you in your home, making more trips. Can we manage this? Can we have hubs, so big lorries coming to some of these centers in the city scattered around the periphery, and then using electric vans to bring the goods to the city? And the biggest cause which we have seen, the problem caused by private vehicles, is modal shift. How do you encourage people to leave their cars and use public transport and walk and cycle if the distances are not great? So people do not like to walk more than 3 kilometers or cycle for more than 3 kilometers. So can you provide this last mile connectivity? People use their cars because they go to the destination, or public transport. If you use public transport, your stop maybe more than 2 kilometers away from the metro station. That last mile connectivity is the problem, and which causes people to still use their private vehicles. Can you can you provide solutions for last mile connectivity? That's the things which are being explored. Excuse me. So electric scooters are one of the solutions. So my take on this is, we have looked at so many action plans, so many solutions, but if a government is looking at one size fit all solution, it is not going to work. There's a range of problems, range of sources contributing to air pollution. Each location is different, the sources are different, activity patterns are different. People, industrial towns operate differently than commuter towns. Topography of the towns are very important. Meteorology is which way the wind is coming from. Can we use that knowledge to site industries not wind but maybe downwind of the cities? So these are the factors which have to be taken into account, in my opinion. Currently, these are missing in planning and policy development. Is our policy proactive or reactive? Reactive is, for example, what is happening in Delhi when you have accidents of air quality, then you suddenly react and start applying GRAP, which is graduated response to air pollution, start shutting down construction and industries. That is a reactive policy. What you need is a proactive policy. You plan for the years ahead, months ahead, so that you don't have these sudden accidents and emergencies declared, for example, in Delhi. Do we have the right set of regulations? Does it cover all parts? So from sources to activity and policy involvement of people or regulators? Is it integrated? Is it forward-looking? So I'm going to present a very good case of forward-looking policy here, which is just being tried in the UK, and we'll see how it works, whether it works or not. Forward-looking policy, 25-year plan. I will cover that in a few minutes. And I think we have too much emphasis on technological interventions. So actually technological interventions are very well known and can be developed probably easily, not very easily, but they can be developed. Is the implementation, enforcement, and education and awareness aspects which are missing here. And if you're talking about air pollution, we have too much emphasis on outdoor air pollution. Here in the UK and most of the cold countries, cold climate countries in Europe, we spend 90% of our time indoors. And we focusing too much on outdoor air quality. How does outdoor air quality infiltrate indoors and vice versa? So we don't have good understanding of this outdoor-indoor continuum. How are the buildings designed? How are they ventilated? And so on. The layout, the distance between the roads and buildings and so on. That has not been understood fully. So we need to spend more time on that aspect. And as I said, no single solution and no national solution can work. Sometimes we need local solutions for local problems. And public perception and acceptability of policies, whatever solution you come up with is very important. Otherwise, you're bound to have failure. So I'm going to give a brief rundown on the new developments in the second half of my presentation. So at national level, the first most important act was Environment Act 1995, which resulted in the air quality management, local air quality management framework, which I presented in the previous slides. But now recently we have new developments, for example, Air Quality Standards Regulation 2010, and then we left European Union, Brexit. And before that, we had European laws and legislation and policy, which was transposed in the UK. Now we are no longer part of the European Union, so we had to have our own set of policies and laws. So the UK government is working very hard to come up with their own plans. So that's why they have 25-year environment plan, which was first planned in 2018, then Environment Act 2021, and 3 other legislation I mentioned. And in the end, I will cover net zero, because usually you'll find that air quality legislation is discussed separately with and carbon climate change policies discussed separately, although in my opinion, they have interrelationship and they might affect each other. So I will give you a brief rundown on how net zero's policies can affect air quality and vice versa. And then at local level, we have seen this local air quality management framework. Is there any feedback loop? So when you're discussing the changes in these acts, are you listening to what is happening at local level, whether it has been successful or failed, and then are we correcting our policy? That feedback loop is very important. So here in the UK, they have set up Office for Environmental Protection, OEP, and then I'm going to talk about this framework and improvement plan, how this can help in closing this loop, providing this feedback loop. So very briefly, these are the current air quality standards in the UK. So for example, NO2 I mentioned the annual mean is 40 microgram per meter cube. PM10 annual mean is 40 and 2.5 is 25 microgram per meter cube. But we also have daily standards. For example, 50 microgram per meter cube not to exceed more than 35 times in 1 year. So you might meet the annual mean standard, but there may be some exceedances in terms of number of days where the levels were higher. The government doesn't want those to go higher than 35 times per year. In Scotland, even stricter, 7 times in 1 year. So this is after leaving the European Union, the government set out a very ambitious plan. It's called 25-year Environment Plan 2018. And they wanted to set out what can we do to improve the environment within a generation. So 25 years, for example. So I just picked up the part which is related to clean air. So there are three key pillars of this 25-year plan. So meeting legally binding targets, the targets which I have just mentioned before, or maybe the new targets, to reduce emission of 5 damaging pollutants. So we all know there are tens of pollutants, and before this time, we were focusing on more than 10 pollutants in the UK. But government has decided that we are going to spend all our efforts and resources in tackling 5 damaging air pollutants rather than all of them. So that this should halve the effect of air pollution on health by 2030. That's the goal. Government has also set aside this target that they will ban the sale of new petrol and diesel vehicles, conventional ones, by 2040. Then the government set a target date of 2030, and 2 months ago, the Prime Minister changed it back to 2035. So we are still ahead of the 2040 plan, but by 2035 in the UK, we will not have any sale of new petrol and diesel cars and vans. Then the third pillar was about industrial emissions, and there are good practices. They're going ahead with the good practices approach, the one which can be achievable. So after that, the government uh, came out with Environment Act 2021 because we did not have any European laws enforceable in the UK, so we had to come up with our own legislation and policy. And according to many of the critics, it is one of the most ambitious environment programs in the world. It provides the UK government with powers to set new binding targets, their own targets. It may be stricter than the European Union targets for air quality, water, biodiversity, and waste reduction. So this is where they have established a new environmental watchdog. This is an independent body called Office for Environmental Protection. They have the power to hold the government and other public bodies, local authorities to account. If a particular area is not meeting the standard, they can tell that local authority and the central government that you must do something about it. So they are an independent watchdog, Office for Environmental Protection. Okay, so under Environment Act 2021, there are 7 parts and each part covers different aspects. So part 4 covers air quality and environmental recall. I will tell you in a minute what environmental recall is. So they have come up with environmental recall part of the act, which says that motor manufacturers or even the government should recall motor vehicles which do not meet the emission standards for that time. The motor vehicles will be recalled and the manufacturers will have to either retrofit them or discard those vehicles and only introduce new vehicles which meet the standards. And if you remember environment legislation or standard for 2010, the standard for PM 2.5 was 25 microgram. This Environment Act 2021 has set very strict standard for PM 2.5, which is 10 microgram per meter cube across England. And they have also recommended a population exposure reduction approach. This is one of the very first ones in the world. So what government is saying that even the areas which are meeting the standards, people are still exposed to pollution level. And if you look at WHO recommendation, there is no safe limit for PM 2.5. Even if it is below whatever standard a country has set, if people are exposed to 2.5, there's bound to be some health effects. So they want the government, UK government wants this exposure to be reduced by 35% by 2040 compared to 2018 baseline. And then to cover that, to deliver that, this is the Environment Improvement Plan 2023. So in 2018, this 25-year environment plan was published. So now 5 years have gone since 2018 when this 25-year plan was introduced. So the government has now mandatory, it was required by that act that they must give 5-year progress report. So this Environment Improvement Plan 2023, which is recently published, has given the progress made against 10 environmental goals. So these goals are listed here. And goal number 2 is clean air. So to show the progress made against these 10 environmental goals, a new framework has been designed. It's called Outcome Indicator Framework, OIF, which will track the progress made under these 10 goals. And one of the goal here is we are talking about is air. So what are the indicators which will reflect the progress made under air environment? So these are 7 indicators which reflect the progress made under air. So emission of 5 key pollutants, emission of greenhouse gases from natural sources, concentration of fine particulate matter PM 2.5, rural background of ozone, roadside NO2 concentrations, nutrient nitrogen deposition is another very important factor which is often ignored in many of the countries, but here in the UK we have focused a lot on the nitrogen deposition from atmosphere on the land and the ecosystem and how it affects the plant growth and crop growth. So the government is now submitting progress made under achieving nutrient nitrogen deposition on ecosystem. Another pollutant which is not even mentioned in many of the countries, including India, is ammonia. So the UK government has focused significantly on the emissions of ammonia, predominantly from agricultural practices. It affects the crop as well as the land exposed to ammonia concentrations. So the government is reporting progress under this. So very briefly, A1, which is emission of 5 pollutants. So these 5 pollutants are oxides of nitrogen, PM 2.5, SO2, non-methane VOC, and ammonia. So under each EIP, Environment Improvement Plan, government has to show the progress made. And you can see since 2005, there has been a steady decline in emission of these 5 key pollutants. If I pick up A3, which is concentration of PM 2.5 in air, you remember the new standard is going to be 10 microgram per meter cube and current standard is 25. So this is population weighted annual mean of PM 2.5 and you can see there has been gradual decline in concentration of PM 2.5 in UK. If you look at roadside NO2 concentrations from 1997 here, for example, short term, medium term, and long term, there has been a steady improvement, and short term, which is from 2015 to 2025 years, has been 29% reduction in roadside NO2 concentration. But if you take the long-term look, then it's about 55% reduction in NO2 concentration at the roadside, which is very good achievement. So the latest legislation in the UK is air quality strategy. It's not legislation, it's the strategy for improving air quality in the country. So this is Department of Environment, Food and Rural Affairs, DEFRA. They have come up with this air quality strategy 2023, which will be updated every 5 years. Now, the Environment Act has legislated that the UK government should update this strategy every 5 years. So this is the latest strategy published in April. It focuses on 6 key areas, or it has 6 key priorities. So first one is planning reform. The government has realized that land use and housing development affects the transport, and transport affects air quality. The link between land use, transportation, air quality, and health is now established but not understood. So they want all the planning to take into account this sequence of events when developing any new policy. Many developing countries, you will find, I come from India, so I know that in India, the land use planning is on paper, but you can see any locality you go, you will find shops, the factories, small scale industries, and many other activities. They're all together rather than zoning. So planning is very important if you want to reduce exposure of people to pollution. This is very important, building capacity in local authorities, local councils through training, guidance, and knowledge sharing. It's one thing that you tell local authority that you have to achieve this target by this date, but if they don't have the enough skilled people, trained people, then they will not be able to even monitor, forget about managing. So building capacity at local authority level is the plan, and government is investing heavily in terms of training, guidance, and knowledge sharing. Third priority is reducing emission from industrial sources. Environmental permits are now in place. Domestic sources are now contribute significantly besides road transport. Because it's a cold country, so people use different fuel to heat their houses. So burning of biomass is causing more smoke and pollution in local areas. And fuel prices, gas and electric prices have gone up more than 3 to 4 times in the country here in the UK in the last 2 years. A lot of people cannot afford to pay electricity and gas bills, so they're burning whatever biomass, whatever material they have, and that is causing extra smoke pollution in certain areas. This is where raising awareness within local authorities of air quality impacts and how to reduce them is important. So a lot of NGOs are now working with local communities, encouraging them, making them aware, educating them about the perils of air pollution and how it is linked with their activity. Can they change their behavior? The toughest job for environmental air quality manager is changing behavior of people and the polluters. That is very important aspect. And that if you do that, then probably people will walk and cycle and use public transport. And obviously switching to public transport requires efficient, reliable, and affordable public transport. It's one thing saying to public that people that you have to use public transport or you should use public transport. But if it is not reliable, efficient, and affordable, people will not switch to public transport. So the last slide I have here is about net zero. So here in the UK, the government has a new policy to achieve climate change targets. They said that by 2050, we will have net zero It means the amount of carbon or greenhouse gas emissions will be equal to amount of carbon or greenhouse gases removed from the system. So it's net zero. So that is achievable by the target date is 2050. So there are several policies for electricity generation, transport, agriculture, building, and industries. They are specifically designed to reduce greenhouse gas emissions or carbon emissions. But no one has looked at the effect of those policies, carbon reducing policies on air quality. So Royal Society has just published this report called Effect of Net Zero Policies and Climate Change on Air Quality. And they come up with a very interesting chart. So this is the effect. On the top, you can see the effect, no effect, positive effect, which is related to improving air quality, our negative effect, which is related to poorer air quality, small, medium, and large. And no effect is here in the middle. So if you pick up electric supplier, electricity generation, if you're opting for renewable energy like solar and wind, the effect will be large and in terms of air quality, it will be improvement in air quality. Nuclear power is another option. Again, it will reduce air quality, improve air quality because it does not use any fossil fuel. CCS is carbon capture and storage technology. It, there's some uncertainty about it, whether it will have positive effect or negative impact on air quality. Transport, electric vehicles at the point of use, they will definitely improve air quality. Electricity generation, which is here for electric vehicles, where the electricity is coming from will have impact on air quality if you're talking about transport. Hydrogen has been discussed a lot. UK government is spending billions of pounds in developing hydrogen technology for power generation and even for use in vehicles. That might have some positive impact. But if you're going for biofuel engine, it is more likely to have negative impact because where the biofuel comes from and how when you burn biofuel, it will lead to generation of nitrogen dioxide and dust. Agriculture practices, if we start reducing the application of fertilizers, then it will improve air quality. Ammonia emission directly linked with fertilizer application. If people change the diet here in Europe, developed countries, people eat meat more than any other place. See, and for example, meat production consumes 15 to 20 times more water than, for example, if you're growing vegetables, and that has direct impact on carbon emissions. So that is the kind of policies and this report looked at. Buildings, again, heating, if you're heating your houses here in cold countries like England, if you're using gas, predominantly it is the gas which is used to heat houses. But now they are absorbing heat from atmosphere or from the ground. So they're called ground source heat pumps or air source heat pumps. They have shown that this way you're using less fuel and air quality is improved. Retrofitting of the houses again can have positive effect or as well as negative impact. Positive effect in terms of carbon emissions, if you are making houses energy efficient and airtight, then you are using less fuel. However, when you make houses airtight, the indoor air pollution will stay indoors and then it could lead to worsening of air quality. So that's why retrofitting of the houses, air tightening of houses could have negative impacts. Okay, so I'm going to give you a summary of what we have discussed in this seminar. So we have seen that in the UK, although we have very good air quality, we still have exceedances of air quality standards. The local air quality management framework is very good at identifying problems, may not be coming up with the solutions, right solutions. So we need to understand the uncertainty and bottlenecks in delivering air quality benefits. of action plans, including net zeros. We shouldn't forget that one policy which is designed for one particular aspect could have adverse effect on air quality and vice versa. We need to understand that difference, that link between policies. So we have seen that legislation is very important, and long-term proactive legislation rather than reactive legislation is the key here. And then, in my opinion, involving citizens and communities is very important. They need to understand their needs and behavior. Activity pattern is very important. Where people live, why they live, how do they travel, why do they choose a particular mode of transport. Unless you understand that reason, you will not be able to bring out any changes. And we also need to look at environmental justice or injustice. Here in the UK, I'm sure in India as well, it is probably the deprived population, poor people who are exposed to higher level of pollution. Can we reduce that environmental injustice? Can we protect vulnerable people, young children, elderly, and those people who are already suffering from medical conditions? So with that, I stop and happy to take questions.
Yeah, Anil, thank you very much. It was a wonderful lecture covering the various aspects of our. Before we look for questions, I'll have one quick photo with you. So I'll just request everybody to start your camera. We'll capture a group photo, and then we'll discuss the questions. Okay, Gopika, will you be able to take? Are you or Ashwin? Okay, thank you. Yeah, Anil, this is really you covered various aspects that are relevant to air quality management. I thought before we take up online questions, one thing which I just noticed, UK has really learned a lot. Try to understand. They really address after the smog pollution problem in 1952, and we have not come across such a issues after that. So, I mean, it means that they are very good in addressing the problem, and they have come out with some regulations. It can regulate the air pollutions. Now, in the current context, we know that the air pollution mostly comes from, we always look at it automobile as one culprit. Otherwise, we look at it the thermal power plants, the coal burning is the another which generally contributes. So do you think that over the period of time, maybe in a 10 years line or a 15 years line, the sources which contributes this air quality management areas, based on your experience or based on you are part of so many committees, leading many delegations. So what do you think, like in India, because this is one observation in India, we carry out source apportionment studies, and the more or less the identified sources are still same.
Yeah, so
I just
very,
need
very,
some thoughts on that direction.
yes, certainly, Shiva, very valid points. And the landscape of the sources and understanding sources has changed. If you remember when we were studying, we looked at Stern's book and it all focused on industrial sources, and because they were the main sources at that time considered to be causing pollution. So the focus was more on industrial pollution. And then there was better handling of that probably in certain countries. So then they started realizing that the contribution of industries is going down. Then other sectors, for example, transport and domestic and agriculture, their proportion has gone up. So now they had to start addressing those issues. And you cannot take one source at one time and start dealing with it. And we have seen from my presentation and from many other presentations before that it is a range of sources and you have to have a holistic approach to it. So that's why, if you remember one of the slides I mentioned about the zoning and the policy, and understanding everything rather than just looking at one aspect, just one contributor is not going to work.
Okay. Yeah. Thank you. So the other aspects in terms of regulatory, in terms of rules and regulations, I always feel that innovation is a major challenge in any country. So what is the maybe lessons learned from in UK in implementing the various air quality management guidelines, or maybe even for the designating the air quality uh, management areas? So what is the lessons learned and how it will be beneficial to the developing countries?
I think you have got this nailed correctly because any country can develop the legislation or even just adopt WHO standard. So developing a policy is one thing, regulation is one thing, but enforcement and implementation is the key. We all know GRAP in Delhi and many other states, they have their own policies, but implementation is lacking in some places. For example, PUC, Pollution Under Control Certificate in India of motor vehicles, if it is enforced correctly, it can result in improvement in emissions from motor vehicles. But if it is not enforced correctly, then it is just a piece of paper certificate.
Okay. Okay. Good. Uh, Other question, which is I thought I should get some suggestion from you. Now it is focused towards NO2 in terms of in most of the other countries also. We have seen that there are a lot of measurements on NO2. Even in India, we have started looking into. Do you noticing that any good relation existing between NO2 and PM 2.5, and any such you know uh, uh, driving or indicators to address particular source?
Yeah, certainly. Very good point. If you remember the CAD time project, which you and I worked together, and we looked at historic data of air quality in Delhi for last 15, 20 years. And if you look at any media coverage, any report, they all talk about PM 2.5 or PM 10. No one, not a single report has talked about NO2. And in Delhi, NO2 also exceeds the standards, Indian standards as well as WHO standard. So we are just focusing on one pollutant, PM 2.5, ignoring at the same time other pollutants. So if you develop policy for PM 2.5, you might not be able to cover the policy, the sources which are contributing to NO2. So you need to have all the key pollutants in mind. And we have seen from evidence that NO2 and PM 2.5 or 10 are the two key pollutants. I give you one example of wrong policy in the UK, and we have learned the lesson. So about 15 years ago, UK government set aside the carbon challenge that we need to have reduced carbon emissions by 2050. And they realized, oh, motor vehicles are causing more carbon emissions, and diesel vehicles actually use less, they produce less carbon per kilometer of travel per liter of fuel burn. So they started encouraging diesel vehicles 15 to 20 years ago, heavy promotion of diesel vehicles, a lot of incentives and subsidies, and flooded market was flooded. More than 60% vehicles in the UK about 5 years ago were diesel vehicles. Then they realized, okay, yeah, carbon emissions have gone down, but PM 2.5 and NO2 level have gone up because diesel vehicles contribute more to fine particles. And now we have another problem. So you try to bring down carbon emissions, but now you increase PM 2.5 levels in the cities. So that policy was wrong, so, but they realized that the policy was wrong. So now they have stopped promoting diesel vehicles. And by 2040, actually now the government is saying 2035, we will not have any sale of petrol and diesel vehicles.
Oh, that's really nice to hear that. Anil, there are some couple of questions online. Are established guidelines and standards for indoor air quality, PM, indoor PM 2.5, PM 10, similar? We only discuss more of urban air quality management, mostly when we talk about ambient. Are there any specific guidelines, rules available to manage indoor air quality in UK?
Yeah, very good point actually. And if you remember, one of the point I mentioned was that indoor air quality is often ignored in discussions, and we spend significant amount of time indoors. And all the legislation all over the world are related to outdoor air quality. We have only occupational health standards, but they're very high levels. So if you're a worker in, say, in a cement plant or power station or fertilizer plant, then the standards are there for occupational exposure. But there are no standards, set standards I am aware of, which deal with indoor air quality. We still apply outdoor air quality. So
Okay.
yes, there is a need to have indoor air quality standards.
This is one more important question. So this validation of health impacts due to air pollution is, although there exist, but there is a need for doing long-term cohort studies, maybe comparing three different areas or four different areas, identifying polluted, non-polluted background. Some aspect is required. Are there any such studies been carried out in the UK, and what lessons or what experience they learned?
So very good question. I think it's from Gupta ji. Is that right? Yeah.
Yes, yes.
Yeah. So Gupta ji, very good point and very different thinking. This is what I like because everyone has relied on certain longitudinal studies. Six cities studies in USA and PAPA study, which is popular air pollution exposure in Asia. Some of those studies. So long-term longitudinal studies, so they have established the association between exposure to air pollution and health response. But there is a geographic variation and temporal variation and short-term exposure. So we are talking about long-term exposure versus acute short-term exposure. What is happening in Delhi right now is short-term exposure as well as long-term both. And that response is not understood correctly yet. There are some studies here in Europe which have linked acute exposure and to response, but not in places like Delhi or many other Indian cities. So yes, there is need to have these short-term as well as long-term studies, and also involve cohorts, for example, pregnant women, children, and elderly people, and those who already have asthma and other symptoms.
Yeah,
So my question,
thanks, Anil. Yeah,
Doctor.
Gupta ji, go ahead, go ahead.
Yeah, my question was also, slightly uh, toward the community welfare. That in Delhi, we have noticed that uh, people are exposed to very, very high level of exposure of CO, NO2, PM 2.5. So, and we are saying again and again that there are health implications, people are dying, and so many million people will die. So, they say will die. So, people have been living around many air quality stations in Delhi. There are about 40 air quality stations in Delhi. But I have been telling health specialists, and in fact, I offered that I'll be willing to sponsor studies if some health authorities can take up a study in a local area where a air quality monitoring station is located. So around that, there may be about 10,000 people living in that area. So are they prepared to do any health studies on this? How many people have suffered because of high exposure of CO? How many people have suffered because of high dust PM 2.5? And how many people have suffered because of high NO2? And because they have been living there for now almost 15 years, because in Delhi, air quality station started in 2010, and now there are about 40 stations. So I am very keen that if someone can take up this local level studies to find out really what has really happened to those people. Have they died? Have they suffered immensely? Or there are no effects? Our standards are needs to be relaxed, or what is going to happen? So we are very confused whether shall we follow these standards or shall we not follow these standards. That is the
Yes,
question.
Gupta ji, in my air pollution lectures to my students here, I have one slide which says that air monitoring stations are fixed locations. They only represent air quality in that particular location, at that particular location where they are sited.
Mm.
That is not where people live. People live in different locations, away from the monitoring stations. Some are very close to activity, some are away from the activity. A lot of people,
So
especially in
this
developing
means we are
countries,
wrong.
their
This means we
shops
have
are,
wrong data. This means we have wrong data with us.
yeah. So we need, so I call it static versus dynamic air quality data.
Mm.
Static data is fixed from fixed stations.
Mm.
Dynamic air quality is the real time spatial and temporal variation in air quality. This is where people are exposed.
Mm.
So a lot of studies here in Europe also, they use people's location where they live and associated with air quality. People don't. People are not static. They move around.
Mm.
In 1 hour they are at home. Second hour they are walking on the road or cycling or going in the car. Third hour they are in the workplace, and then lunchtime they're doing some shopping. So you need to have this community level 24-hour exposure platform. Then, and I fully agree with you that you cannot do it at a bigger scale. Just select a small area
Yes.
and
Correct.
study these people and link it with your fixed station and see how representative that station is.
Right. Thank you. Thank you, Anil.
There is a one question related to net zero by 2070. So there are UK's 2000 generating station relies on renewable energy compared to India, where coal-based power plants are heavily relied on to meet the energy security. Is there any specific policy of the UK that worked well and could be sustainable to in achieving net zero by 2070? I think for
Yeah,
India, in
a
the
very good point.
context.
Again, very good point. And I'm glad that India has come up with this net zero date, 2070. Prime Minister Narendra Modi did it, I think, 2 years ago when we hosted this big international conference.
Yeah.
So UK have gone ahead with 2050. A small country, so maybe they can achieve it. India is a very fast developing large country, so 2070 is more realistic. Power generation is 40% of carbon emissions in India. So if you're relying on low inferior quality coal, then it is not going to help. India is lucky, fortunate that it has abundant sunshine and coastal area where wind is there. So you can, and Indian government is going ahead with solar and other renewable energy generation. But even here in the UK, where solar power is not that strong wattage, still we are able to generate electricity from solar panels. So think of India, where out of 365 days, more than 310 days are sunny. You can generate more solar energy and wind energy and replace inferior quality coal and capture. Carbon capture is the technology which UK have invested heavily, and now they are ready to sell it to the other countries. So this is the business acumen. They realize that most of the countries will need some technology to capture carbon. So they have developed this technology. Now they are selling it to other countries. So if you think ahead, then you can have businesses which can benefit you.
Yeah, thanks, Anil. I think it was a wonderful talk, and the discussions were very useful. And you covered almost starting from the air quality characteristics in different places, identifying air quality management areas, then linking to the health, and some experience in addressing the air pollution issues in UK. So it was a wonderful talk. We, on behalf of Air Quality Management Association, and on behalf of Department of Civil Engineering, IIT Madras, and Indian International Conference on Air Quality Management, and CEPHA network, and all the participants. Would like to thank you for taking your time for giving this wonderful talk.
Thank you very
very
much.
much.
Thank you very
Thank you.
much for
And
having me.
Thank
I
you.
also
Thank you.
thanks all the participants joining us. Thank you. Bye, Anil. See you.
Thank
Okay,
you.
bye. Bye.
Bye.